we've mentioned, from wearables and microbiome and genome and our digitome to start to mash those up. This idea of the digital twin, I don't think has been mentioned yet, so that we can start to put that together in a meaningful way so that we can optimize care on the continuum from putting my pediatrician hat, early intervention or prevention or inoculating kids against mental health challenges all the way to that's possible on common or severe mental illness. So I'm involved in advising a few companies that are doing interesting work, like an investor in a company called Marrow Health, which is scaling digital interventions with real psychologists for anxiety and depression. Or the issue on scaling is often bringing not just data, but insights. We've got lots of data, but no clinician wants the raw data. They want the insights that they can leverage in their workflow, or the patient or the caregiver or the human. So I think an exciting example of the edge of that today is a company called StuffThatWorks.health out of Israel that's sort of building a Waze or Google Maps for health, where you can share what's working or not working, from everything from psoriasis to depression to anxiety to rare cancers, and crowdsource that information to the point where it's useful to you, patients like me or patients like mine, and then integrate that into clinical care. So those are a few examples, and I think the proviso for all of us thinking with the end in mind for a decade is to think where things might be with AI, robotics, the 3D printing, to nanotech, to voice as a biomarker, to the $100 genome, and how do we put those together in ways and not be stuck with our concept of what's possible in 2022.